Why insulin is not taken orally? Insulin is one of the most important medicines used in the treatment of diabetes. But have you ever wondered why insulin is not available in tablet form like most other drugs? Why do diabetic patients need injections instead of just swallowing a pill? In this video, we will clearly explain why insulin cannot be taken orally, focusing on digestion, absorption, enzymes, and bioavailability in simple and easy to understand way. Insulin is a life-saving hormone used in the treatment of diabetes mellitus, especially type 1 diabetes and advanced type 2 diabetes. Even though insulin is essential for controlling the blood glucose levels, it is surprising that insulin is not given orally like most medicines. Instead, insulin is administered through injections. Insulin pumps are inhalation routes. In this video, we will clearly understand why insulin cannot be taken orally, focusing on its chemical nature, digestion, absorption barriers, and pharmacological limitations. What is insulin? Insulin is a peptide hormone produced by the beta cells of pancreas. Chemically, insulin is a protein composed of amino acids arranged in two peptide chains linked by disulfide bonds. Its main function is to regulate the blood glucose levels by promoting the glucose uptake into the cells and inhibiting the glucose production in the liver. Okay, so because insulin is a protein, its structure is very delicate and easily affected by the environmental conditions such as pH and enzymes. So what happens when we take the oral medicines? So first we will see about that when a medicine is taken orally, it enters the stomach first. So the stomach contains the strong hydrochloric acid and the digestive enzymes such as pepsin, so which mainly helps to break the food here, especially proteins. So after passing through the stomach, the drug reaches the small intestines where further digestion occurs and the absorption into the bloodstream takes place here. For a drug to be effective orally, it must survive the stomach acid, resist the digestive enzymes, and cross the intestinal lining into the blood. Okay, so what are the effects of the gastric acids on the insulin? So, insulin is a protein, and proteins are naturally break down during the digestion. So, in the stomach, what will happen? So, hydrochloric acid denatures the insulin, meaning it mainly destroy its three-dimensional structure. So, once the structure is destroyed, what will happen? The insulin loses its biological activity. So the digestive enzymes such as the pepsin further break the insulin into the smaller amino acids. So just like dietary proteins. So therefore the insulin taken orally gets destroyed. So before it can reaches the bloodstreams. Okay. So what is the role of the digestive enzymes? Even if insulin show how survives stomach acid, it faces another major problem in the intestines. So enzymes like trypsin and chymotrypsin digest the proteins into the smaller fragments for absorption as nutrients. So insulin is treated by the body as a dietary protein, not as a drug. So these enzymes rapidly degrade the insulin, preventing it from remaining intact and functional. So, as a result, no active insulin reaches the systemic circulation. So, the poor absorption through the intestinal wall. So the intestinal lining act as a selective barrier here. So the large molecules like insulin cannot easily pass through the intestinal membrane here. So the insulin has a high molecular weight and is hydrophilic, which prevent it from diffusing across the lipid membrane here. So unlike the small drug molecules, insulin cannot be absorbed effectively through the passive diffusion. Therefore, what will happen? Even if insulin is not destroyed, it cannot cross the intestinal wall in sufficient amounts. First pass metabolism effect. So another important reason insulin is not given orally is the first pass metabolism. Drugs absorbed from the intestine pass to the liver before reaching the systemic circulation. So the liver contains the enzymes that metabolize the drugs. So the insulin enter the liver orally would be rapidly broken down and inactivated. So this results in a very low bioavailability, meaning almost no insulin reaches the target tissue. Bioavailability issues. Bioavailability refers to the fraction of a drug that reaches the systemic circulation in an active form. Oral insulin has extremely low and unpredictable bioavailability. This makes it impossible to control the blood glucose levels accurately. Diabetes management requires precise dosing, and oral insulin cannot provide the consistent or reliable effects. Why injection is the preferred route? Insulin injection deliver the drug directly into the subcutaneous tissues bypassing the digestive system. So this protects the insulin from the acids and enzymes and allow it to be absorbed slowly into the bloodstreams. Okay. So insulin injection ensures predictable absorption, accurate dosing, and effective blood glucose controls. So this is why insulin is commonly given via subcutaneous injections. Are there alternate to oral insulin? Researchers are working on alternative delivery systems such as inhaled insulin, nasal insulin, buccal insulin, and nanoparticle based oral insulin formulations. These methods aim to protect the insulin from the digestion and enhances the absorption here. However, oral insulin is still under development and not yet widely available due to stability and absorption challenges. Conclusion: insulin cannot be taken orally because it is a protein that gets destroyed by the stomach acids and digestive enzymes. So cannot be absorbed effectively through the intestinal walls and undergo the effective first pass metabolism in the liver. These factors results in a very low bioavailability and unpredictable therapeutic effects. Until technology overcomes these barriers, insulin injections remain the safest and the most effective method of administration. Thanks for watching. Please like, share and subscribe to our channel for more medical learning videos.